Ever think about how ADHD affects teens? It's even tougher if it goes untreated. Hi, I'm Dr. Jody Gold, a pediatric and adult psychiatrist, here to talk about the internet's biggest questions about ADHD and teens. What are the signs of ADHD in teens? One of the big signs is an increase in high-risk behavior, especially among untreated ADHD. So kids in high school with untreated ADHD are much more likely to drive quickly, to drink too much, to vape too much, to be impulsive in social media, to have poor grades. The other things we see in high school is we see an uptick in academic rigor, and we see the social stuff just gets more and more stressful. I particularly see this around the standardized tests. Often the SATs and ACTs really stress someone, and all the competing stimuli really make it challenging, and you will see the signs of ADHD for the first time. In addition to the academic rigor, to be honest with you, there's also increased social rigor, as we all know. Trying to manage social media and trying to manage relationships in high school can be really challenging. So what we see is kids that are struggling more academically, we see kids that maybe are falling behind socially, and we see kids with an increase in risky behavior. So all of those things are signs in high school. And the truth is that ADHD, while it's lifelong, often gets diagnosed at different ages and stages. So it's really important, no matter what the age is, to identify early and to diagnose and treat. It can make a huge difference. What are the signs of ADHD in preteens? So this is the age where executive functioning begins to really matter, both socially and academically. So in middle school, it's the first time that kids are sort of independent academically. They walk around from class to class. They're responsible for their own assignments. There's a lot less scaffolding. So this is a moment where we might see kids that were doing fine in elementary school move into middle school and struggle with remembering to turn in their homework, keeping on a schedule, like understanding where they're supposed to be. Socially, it's also a time where kids are becoming more independent. Your parents are no longer scheduling play dates for you. You're now responsible for initiating communication, following through, setting up hangouts or play dates. Lastly, the other thing we see in middle school is when we begin to see a lot more of ADHD inattentive type. In lower school and elementary school, we often see disruptive behavior. We see hyperactive. But in middle school, what you might see are kids that aren't necessarily hyperactive, but in the classroom, they may be more inattentive. And so that may get picked up in middle school where it didn't get picked up in elementary school. What are the risks of untreated ADHD in teens? Well, there's actually a lot of risks. Kids who have ADHD that are not treated are at higher risk of reckless driving, substance abuse, unwanted pregnancies, disruptive behavior, poor grades. I can go on and on. The good news is that if you're actually properly treated for ADHD, all of these risks go back to normal. So it's really critical to get early diagnosis and treatment. Let's pause for a quick question. Do you remember the first time you noticed that your teenager had ADHD? Tell us about it in the comments. How do you parent a child with ADHD? First and foremost, you need to understand that it's not your fault. ADHD is a medical disorder just like asthma or diabetes. You're not a bad parent, your child's not lazy. So once you understand that, the next thing is you need to get educated. You need to learn as much as you can about ADHD. Once you understand the diagnosis, you can begin to be an advocate for your child, and you can begin to build the team that they need. You can then teach your child how to be an advocate for themselves, which is the key part of managing ADHD. And it starts by you not blaming yourself, building a team, and modeling for your child how to be a good advocate. How can you motivate a teenager with ADHD? Okay, so if you have a teenager, especially a teenager with ADHD that's not being fully treated, you may have a teenager that doesn't feel very good about themselves. The first thing you need to do is validate. Validate how they're feeling and sort of meet them where they are. Help them to understand that there is a pathway to getting better. I mean, if you think about it this way, you would never send your teenager who needed eyeglasses to school without their glasses they couldn't see. So you can't send a teenager to high school without the proper treatment and expect them to flourish and feel good about themselves. However, teenagers really don't love to hear their parents or their therapists talk. With teenagers, you've got to meet them where they are. So you have to figure out what they care about. Do they care about their grades getting better? Do they care about having more plans on Saturday night? Do they care about their parents not yelling at them for making their room a mess? Whatever it is they care about, that's your hook. And then from there, you need concrete goals. Not just rah. It needs to be, we're going to make your grades a little bit better. You're going to start making plans. Whatever it is, if they're on board with you, you've got them there. And that's That's the way to motivate them, and that's the way you're going to see change. Did you like this video? Because we have a lot more resources like these on our channel. So go ahead and subscribe to get the latest research and tips from top experts like me on learning and thinking differences like ADHD and dyslexia. Thanks for watching.